In this video, we're going to be looking at the vertebral column. We're going to finish out the axial skeleton. The vertebral column consists of cervical, thoracic, lumbar vertebrae, and then the fused sacrum and the fused coccyx. There are 7 cervical vertebrae, 5 lumbar, 12 thoracic. The sacrum consists of 5 fused vertebrae, and the coccyx has 4 fused vertebrae. I'm going to pick a lumbar vertebra just to show you some of the basic structures of a vertebra. So this is lumbar. You'll notice it's fairly large compared to the other vertebra we're going to look at. Our lumbar vertebra holds most of our weight, so it needs to be a little bit bigger. This portion of the vertebra is called the body. This is the arch. Within the arch, we have the vertebral canal, and this is where the spinal cord would go. The arch consists of a pedicle and a lamina. We have some processes to identify. The ones on the sides, here and here, are called the transverse processes. The one at the top here, this is called the spinous process. There are a couple of other places here to look at. These form facet joints with the vertebra that is immediately inferior and superior to this vertebra. So you'll notice that this surface here is rather smooth. That indicates that that is an articular surface or a joint surface. The other thing that you would have with this vertebra is a disc. So discs are between the different vertebrae, and discs are made of fibrocartilage, which is one of the 3 types of cartilage that we've learned about. And discs help to absorb the shock when we're walking or running or doing other activities. Next, we're going to look at how do we tell one vertebra from another. So I've got my lumbar vertebra. I'm going to just pick out a random thoracic and then a cervical. So the lumbar vertebra that we've looked at, you've noticed is quite large compared to the others. So it has a large body on it. The other thing is that its transverse processes are fairly straight, and its spinous process is pointing straight up and is what I call a little bit chubby. So that's lumbar, larger. The thoracic vertebra has a spinous process that will point downward. So it's not straight up, it's pointing downward. The body is smaller, and the transverse processes angle up a little bit more, and this is because there's going to be a rib that will come off here and go up and form a joint here. This is an articular surface before entering into the rib cage. So this is a this is a thoracic vertebra. This is cervical. So cervical is pretty easy. They're the smallest, but they also have some foramina in them that other vertebrae do not. This is a transverse foramen. There's one on each side. Inside the transverse foramen, you'll find the vertebral artery and vein. The vertebral artery supplies blood to the posterior part of the brain, and the vein brings the deoxygenated blood back. So the cervical vertebra will have these little holes or foramina in them. And you'll notice that the body itself is much smaller than the others. And the spinous process might actually be what we call bifid. There are 2 special cervical vertebrae. C1 and C2 go by different names. I'm going to pick those out. We're going to look at those. So on your right is C1, and on your left is C2. C1 is also called the Atlas. Atlas in mythology is the person who holds up the world, so the Atlas holds up the skull. C2 is also called the axis, and it is what the atlas rotates on. So if we put them together, they sit like this. And the axis allows you to shake your head no, left and right. And the skull would sit right here, and you could say yes by rotating on these articular surfaces. So C1 is the atlas, C2 is the axis. This protrusion here is called the dens, D-E-N-S, and it is what articulates here with the axis, and there's a ligament that goes across to keep everything in place. So be able to identify C1 and C2 and know their particular names. Now the other thing I want to show you is this little model here I have. This is 3 lumbar vertebrae put together. I know they're lumbar by looking at the spinal processes. This little model also shows the discs, which are the fibrocartilage. I can put my little pointer down here, and this would represent the vertebral canal. That's where the spinal cord would go. But then you also see little openings that are made by each vertebra. These are the intervertebral foramina, or one would be called the intervertebral foramen. And there's one on each side. So you have one here, and you have one on the other side. Spinal nerves exit at the intervertebral foramen. Now what would happen, let's say if you had a disc, represented by blue here, you could have a disc bulge, you could have a disc actually herniate. So a disc is composed of a couple of different things. There's an annulus fibrosus, which is the ring around it, and then in the middle there's a softer part called the nucleus pulposus. Well, in actual disc herniation, the nucleus pulposus herniates through that ring, that outer ring. And if you were to have a herniation that pinched or impinged on a nerve, you would start having some pretty severe pain in your leg or arm. So this is lumbar, so it would be in your leg. If the disc actually herniated into the vertebral canal, you would have pressure on your spinal cord. And that would create probably a lumbar stenosis. So this is a sternum, and it's got some cartilage attached to it, costal cartilage here. There are 3 parts of the sternum to know. The top part is the manubrium. This little notch here we call the sternal notch. It's a palpable landmark. You can palpate that or feel that on yourself. The larger part here is the body of the sternum, and this is the xiphoid process. Keep in mind that xiphoid is spelled X-I and not X-Y. So I'm going to move that over here and come back to ribs. We're not going to look at all the ribs, but I do want you to note a couple of things. So I've gone back to my thoracic vertebra. I know it's thoracic because it's got the spinous process kind of angled downward. And I've got a rib here. So I can put this rib where it might be on that vertebra, and you can see how it articulates with it with this transverse process. So what do you need to know about ribs? Well, one, you need to be able to identify this bone by itself as a rib. And then the other thing to know is that there's a groove, and it's going to be on the inferior aspect of the rib. This groove is called the Costal Groove, and within it you'll have an artery, a nerve, and a vein. It's important to know this groove is here, and that's where the arteries and veins cross, because if you're going to do like a pleurocentesis, which is a procedure to remove fluid from the lung, you would always want to go superior on a rib and not inferior. So the next thing we're going to do is we're going to look at a rib cage. So here we have an articulated skeleton. Let's review our sternum. Remember, there's 3 parts: manubrium, body, the xiphoid process. This is the sternal notch. There are 12 ribs on each side. Remember, there are 12 thoracic vertebrae, so 24 ribs total. You have true ribs and you have false ribs. The distinction between the two is that the true ribs all connect directly to the sternum. So 1, 2, 3, 4, 5, 6, 7 are true. You can see the costal cartilages going all the way straight to the sternum. The other ribs are called false ribs because either they don't connect to the sternum or they connect indirectly. So 8, 9, 10, you'll see their cartilages come up, but then it's going to connect with this cartilage before going to the sternum. And then there are some floating ribs. 11 and 12 are floating.